I'm Dr. Niranjana from Chennai. My question is very, very basic. In group room, we have come as not done a FNB or any other degree in fertility. So we've come here for a hands-on training as a general gynecologist. If at all we have to go and start, what are the ART rules say as a guidelines to practice, and should we get a certification to start?
See, ART rules are very clear. In case you want to write any hormone also, for IUI, then you have to be level 1 registered clinic. And for IVF, in case you want to write, you should be working in a level 2 registered clinic.
Registered.
In case you are a gynecologist, you cannot stimulate a patient either for IUI or for IVF until you are registered as the gynecologist trained in IUI or IVF. But any gynecologist, even DGO, can carry out IUI. So IUI is never a problem. But for IVF, in case you want to look at the patient and give her some hormones, you cannot do that until you have got, in case you have, you come post 2022, then you need some sort of a certification which says that you have done 50 OPUs. And the government has been very, very kind to us. See, nobody is perfect, but they have only given you 50 OPUs. If you look at the Maribor consensus, they say 75 OPUs and 75 embryo transfers.
Someone should certify us that we have done it.
Yes, and not a private clinician. You have to get certifications from you should do a recognized course which is recognized by NMC, National Medical Council.
Okay.
See, suppose you are a private practitioner. You can't start training people to do OPUs.
Okay.
They can't even enter your clinic. You can do that. You get your university placement from some university. It can be any university in your town who can give them a course, and then university monitors the training. Then you can do it. But you cannot do it on your own, not at your friend's clinic. Your friend clinic can't enroll you only.
Okay.
Do you get my point? Your friend clinic can't allow you to enter their clinic because you are not 50 OPU plus. So your friend should get some recognized courses, say from our bodies like IFS or maybe SR, maybe FOXY certified courses. Maybe FOXY is not many courses, more basically from IFS and SR or SR or IFS, where they'll give you a university like ours are with MIT University. Or there are so many universities which offer you courses of 1 year each or 7 or 8 months each. You can do them. But those courses, universities, when they give to a clinic, these have to be done at tandem. It's not that any private university will give you a course. That course has to be recognized by Government of India also. You get the point? So
having learnt all this, if we have to practice, then we have to go.
You have to do a course.
Certification.
And you can go to any good place near your place who have got a certified training module. Don't go and pay money to anyone who is not certified to that course won't be valid thereafter. Okay. A large number of people go and do pickups, but when they come back, they have no idea they have done things, because you have to be registered in that medical council. Now suppose you want to come to Delhi, you have to be registered in the medical council of Delhi. Number 2, you have to get your PNDT on my machine. You can't get PNDT without getting registered in the National Medical Council. I mean, that's State Medical Council.
Okay.
So this you have to do, no? Only then you can do the pickups. So don't get carried away by some people who offer you these courses, because it is not right. One day somebody will catch. And how does government work, no? Government will keep monitoring your accounts. You keep moving money in, out, taxes, GST. One day government will send you an income tax notice. So once you are doing these courses, people will one day ask you, where is your PNDT certificate? A large number of people will travel from Delhi to Karnataka, Karnataka to Ahmedabad to maybe Mumbai or to Delhi, and they do their training certificates. Remember that until you have not taken temporary admission in the local university there, I mean, then you have to take a Bangalore Medical Council certificate or Gujarat Medical Council certificate. Only then you will be able to get PNDT clearance.
Okay.
Because you have to apply to work on that PNDT. You can't hold the probe like this. You have to get PNDT on that machine. The PNDT, they'll ask you for temporary or permanent registration in that state medical council. It's not an easy thing to do.